My name is Brad Petrosor. I'm one of the orthopedic surgeons here at McMaster University. I work at the Hamilton General Hospital in orthopedic trauma and foot and ankle reconstruction, and I'm also the program director of the orthopedic training program here at McMaster. We use the CanMed's rules and guidelines from the Royal College to help achieve that goal and really empower the surgeons of tomorrow with those aspects: evidence-based clinical care, creativity, professionalism, and the capacity for lifelong learning. Being affiliated with McMaster University provides this program with opportunities like no other program. We have the opinion leaders in evidence-based clinical care here at this institution. Some of our faculty here are faculty at the How to Teach Evidence-Based Medicine course that's put forward every year here. And this is an international course, and this course is open to both all of our residents and faculty and open to everyone internationally.
I'm Dr. Paul Masuna. I'm an orthopedic surgeon here at McMaster at the McMaster site. My area of specialty is pediatric orthopedics and trauma, and I do a lot of spinal deformity surgery, scoliosis correction. And I would like to welcome you all to McMaster. I personally want to reassure you that McMaster is a well-balanced program with a lot of opportunity, where you are both nurtured and accountable. And accountability applies to both the staff and to the residents who are here. And my other comment that I can make is that when you are finished in the program, you will be an orthopedic surgeon with ability and experience.
I think when you look at our residency program, we have some fantastic residents here now, and I think that's probably, in my opinion, the most important thing at this point is that we have some great residents who are doing some really good work, and they're really good educators for the junior residents that are coming along. I think when you look at the program, there's a number of strengths in it. I think the balance between on-the-job educational experience with self-directed learning, and with all the educational sessions, I think really by the end of the training, I think all our residents have done very well and really have the knowledge that they need to go on into practice. I think when you look, we have a fairly big program, and that allows a relatively good call schedule, so I think there's some balance with personal life as well, a lot better, I know from personal experience in other programs. When you look at the future at this point, I think it's exceptionally good. There's a number of staff in this city that are really keen on making this the best program in Canada. There's a number of residents we have now that are just super residents, and again, they want to make this the best they can. So I think that over the next few years, we're definitely going to become #1 in Canada, and I think we'd like you to join us. So please consider applying to our program, and I would like to see you here in the future. Thank you.
Over my 10 years here, I've seen a great evolution of the program in terms of having new staff surgeons being hired. And as a result, really all the subspecialties have been represented now. So I think your exposure to the various facets of orthopedic surgery would be greatly improved now that we really have surgeons from pretty much every single subspecialty area. In general, we have very good relationships with the residents, very collegial relationships, where on a 3-month rotation, I think you really do get to know the staff surgeon quite well, and the surgeon gets to know the resident very well. We have some significant changes happening at McMaster, and I think these changes are going to be ongoing, improving the program in every which way. Some exciting things that I think will be developing are faculty development workshops as well as resident development workshops in terms of all the CanMed competencies, especially residents as teachers, and I think that's a great thing to develop. Having grown up in Toronto and having immigrated from India to come here, really Toronto was my life up until undergraduate education. I actually came to Hamilton as a place to live as an undergraduate student at McMaster University for 2 years. I then went to Toronto for 4 years of medical school, and then came back here as a staff surgeon in the year 2000. So I've been here for 10 years, and I think this is a great place to live, a great place to learn. I think Hamilton has great amenities locally and in the surrounding areas. If big city life is important to you, you can be in downtown Toronto in 40 minutes. If quiet countryside life is for you, then really you have that all around. There's a fabulous trail system here that you can run and cycle and walk on. There's an annual Paris to Ancaster bike race. Hamilton has the oldest running race on earth, even older than the Boston Marathon, and that's called the Around the Bay race. And that happens every April or May, I believe. And runners from all over the world come for that. So if you're into that, which you can tell I am, then that's a great thing to come for.
I trained at McMaster with my orthopedic training for 5 years, and then I did 2 fellowships afterwards. My first year in Ottawa with Don Johnson, focusing on knee and shoulder surgery, especially the knee. And then my second year was at Cornell, the Hospital for Special Surgery, where I trained in hip arthroscopy and general sports medicine. My role at MAC here is as a sports medicine orthopedist, hip, knee, and shoulder. I have a special interest in hip pain in the young athlete. I came back here because I felt that I was prepared for my fellowship extremely well, and I wanted to give something back to the program. I never had a difficult time or any adjustment issues wherever I went, and I felt I could compete with both the elite of the so-called sports world in both US and Canadian settings. So because of that, I felt I should bring back some of the skills I learned and contribute that back to McMaster. As far as other interests, I have an interest in the elite athlete as well. Last year I worked with the US Women's Olympic team, soccer team, and also with the New Jersey Nets in the NBA. And I hope that with the residents coming in, we can start to have some exchanges where we have the residents go down to places where I train, New York for example, where they can be exposed to the elite athlete and hopefully facilitate their fellowship training and opportunities that way.
I trained at Duke University in the United States and also at the University of Toronto. I'm a tumor surgeon, and I also head up the resident research at McMaster. I'm also a surgeon scientist, and I run a research lab at the Cancer Center in Hamilton, and I study primary bone tumors, particularly cell and molecular biology. I welcome any residents who come to McMaster if they're interested in doing basic science research to come and join our team in the lab, and we very much enjoy the input of clinicians, particularly surgeons and orthopedic residents. One of the strengths of McMaster is that we have basic science research, clinical research, both retrospective and prospective, and as well, one of the major strengths of our program and that I can speak to is that we have an oncology program, and within Ontario, not all universities have an oncology program, so we are able to educate residents from Thunder Bay as well as Hamilton. We have Wednesday morning rounds where we learn tumor every week, so by the end of your residency you should know tumor very well without having to feel like you're missing out on part of your education.
My name is Brett Dunlop. I'm the head of the Division of Orthopedic Surgery at McMaster. We have a long, proud history of success with our residency program, and we continue to push forward to improve it. Our staff has been regenerated and reinnovated. To those applying to our program, I would say that one of our strengths is the success, both clinical and academic success of our graduates. We've had people that have gone to be community orthopedic surgeons and have been well received in their communities and done very well. And we've had a number of our previous students who have become academic orthopedic surgeons and also have been very successful.
Hi, my name is Mo Pandari. I'm an orthopedic surgeon and clinical researcher at McMaster University. After completing my medical school training in 2004, I started my orthopedic residency here and subsequently went on to complete a Master's of Epidemiology at McMaster. Realizing the importance of evidence-based practice at McMaster, I've taken every opportunity I can to promote high-quality orthopedic research, improving the hierarchy of evidence, and ultimately dedicating a big part of my career to the promotion of large-scale, high-quality, valid research. To this end, we hope that we offer a lot of our incoming residents opportunities that they would not have anywhere else really in the world. I'm very proud to say that over the last decade we've built what we believe is the largest and most prolific clinical trials research center in orthopedics around the world. With all the infrastructure that we've been able to develop, this brings great opportunities for residents to interact with high-quality research personnel, as well as a number of international trainees that we have the privilege of training every year. McMaster University is able to separate itself from other universities in a few key areas. First is, it is the birthplace of evidence-based practice. In 1990, Gordon Guyatt, a professor of medicine here and who continues to work here, actually coined the term evidence-based practice when he took over the program directorship in 1990. Subsequent to that, we've taken every opportunity we can, and under the new vision of our program director, Dr. Petrosor, we will continue along those lines in moving orthopedics into the new paradigm of evidence-based practice. McMaster also has a strength in that we have a very high concentration of expert surgeons and expert researchers within the departments of surgery as well as the Faculty of Health Sciences who collaborate very frequently. I would encourage, and I continue to encourage, all of our residents in training to take ample opportunity to gain exposure to this rich environment that we've created in research for them. When I look back at a decade of orthopedics, and I look back sort of at my own personal career, I often wonder if I'd have done everything the same way. And I'll tell you one thing I wouldn't have changed. I would never have changed the day I stepped foot at McMaster University, because it was that interaction and the people I've met here that have absolutely and unequivocally changed the trajectory of my career. And I hope that will be an opportunity for some of you to consider McMaster as a top choice for your orthopedic residency training.
I think one of the great strengths in our program is the collegiality that exists between the staff and the residents. The residents truly are a valuable member of the orthopedic team. They get into the more senior years, but I do really think that the staff and the residents have a very good relationship, and although there is still the staff-resident hierarchy, I think that the staff and the residents enjoy a very friendly interaction on a daily basis, and we look forward, and it's a pleasure to train the residents because we know they will be our colleagues in the near future.
Well, we've developed a skills lab, which is under McMaster University Mumsy site right now. Our second skills lab is going to be started in the next 2 weeks, of which we're going to have integration within the OR, so people are able to see the operation and practice it while it's being done in the operating room at the Hamilton General Hospital. So these are a couple of new things that are starting. We're hoping to be able to teach a lot of the surgical side of the arthroscopy at the same time as doing the research.
I just want to point out the fact that she's had no anesthesia here and she's having a reduction of her fracture and she's still smiling. You almost never see this. So we're able to reduce fractures without causing any pain in this program.
I'm Dr. Dale Williams. I'm one of the assistant professors in the Department of Surgery for the Division of Orthopaedics. I work in arthroplasty and trauma at the Henderson site in the city of Hamilton. I actually did my training here at McMaster University for orthopedics, went away, and then was lured back because I had such a good time. We're a very resident-friendly and resident-focused program. We ensure that our trainees are absolutely prepared for life as an orthopedic surgeon in the community or in an academic practice.
McMaster offers, from an educational point of view, being part of evidence-based clinical care. From an academic point of view, if one wants to pursue a clinical science, the Masters in HRM, or Health Research Methodology, here at McMaster, we've had a number of trainees go through that program, and this is a very successful program. There are many great programs in Canada, and I went away for fellowship to Europe and realized that training within Canada, as put forward by the Royal College, is excellent, no matter where you go.